Say, oh yeah, Bema, Sankomo, Ehunya pa. A man come on. It will be a self take or office or fee. Be I will say, Gaya, more somraha. A member, yen, you know. Yaria Bakwaya, a tahaya junipa. A prostate. Prostate. And a hard journey papa. Enti a wako here, say, and Comobia, a far prostate hono, a fanasim here. Ebia what's in the pain? Ebi so I won't say that. Your health condition be hard. Your friend benign prostate hyperplasia. Oh baby sir, sabra for kakano e DNA and I pay your betuche sound comono. Well, I've been joined here by Dr. George Haramis. He's an urologist. What's I say? And then the betuche sound comono potoka say. Nafi Bph Nsem. It's an semredua, a prostate who how hodua aya etete mema no yetimi esano. So Dr. Haramis is already seated. He's here with Fusina. I got you on that one. I know. Doc, good morning.
Good morning.
How are you doing?
I'm doing fine. Thank you so much for having me.
Well, thank you very much for coming. So let's start off from here. What is the prostate and what exactly is the function, Doc?
Okay, so the prostate is a gland. Mm-hmm. This is a gland that is found just below the urinary bladder. And it surrounds our urethra.
Okay.
The urethra is the tube from where the urine is coming out. And it is very important for men. It is in the center of our reproductive and genital system because it provides all the fluids and the nutrients that our sperm is needing. So it is very, very important for the sperm itself and for fertility.
Okay, so then I mentioned the health condition, benign prostate hyperplasia. I don't know what does it mean, and what are some of the symptoms, Doc?
Okay, so let me tell you in simple words. This is a natural process of our prostates. All men after the age of 30, 35.
After the age of 30, 35.
It starts slowly a process of enlargement. Our prostate becomes bigger. Of course, this process is different from man to man. It means that in some persons this process is happening faster than others.
Okay.
And when the prostate reach a specific size, a certain size, which is much bigger than the normal one, then it starts to squeezing the walls of the urethra, and it causes a problem in urination. And this is what the patient initially experience. For example, they have a difficulty maybe starting the urination, or when they pass the urine, the stream is very weak and they spend more and more time to the toilet. Or very, very commonly, they complain that, for example, they cannot sleep very well at night because they have to wake up multiple times in order to go to the toilet to empty their bladder.
Okay.
So these are the first symptoms. And the problem here is that men, they have this wrong perception that this happens because they grow older. But actually, this is something that can definitely be controlled, and they don't have to be afraid of that.
Are you saying it has nothing to do with age? Is that what you're saying?
I mean, it is related with age. But it doesn't mean that because we start noticing these symptoms that we cannot get help from a doctor in order to fix this.
Okay.
Because some people, many times, they tell me, now, I'm old now, and I got used to this. And you ask them, do you sleep at night? They say, no, I don't sleep at all. But they accept that, which means that maybe there is a little bit of a fear to go to a doctor and just speak about these issues.
Okay, all right. So if I'm 30 to 35,
yeah, the symptoms starts to appear around the age of 50. Okay,
50.
Yeah.
Okay, how often do I need to see an urologist if I'm between this age bracket? No.
That's a very nice question, because what I really want to state here is that people of African origin, we know from the studies, epidemiologic studies all over the world, they are more prone to this condition. So it means that they can really develop the symptoms, and sometimes the disease itself is a little bit more intense than other people. So that means that we usually say the guidelines, the international guidelines say that people tend to, they have to come to see a doctor whether they have symptoms or not by the age of 50. But I think for people of African origin, I think it's much better to start from the age of 45. Okay. The prostate has two basic diseases. The one is the enlargement that we just discussed now, the BPH. But don't forget that men need to be checked also for cancer, which is a big issue here, because a lot of people, they don't visit the doctors at all, and most of the time we see the patients in very, very advanced stages, and it's really unfortunate this, because whatever we can diagnose it in the very beginning, we can definitely provide a definitive treatment and cure. So my suggestion as a urologist now is for every man to make at least an initial screening at the age of 45. And I think it's not so difficult to spend 1 day per year just to check your urologist, to have a checkup, an annual screening test, and your doctor, the doctor then knows your history, and it's much easier there to treat this condition.
Maybe you throw some light on how BPH is diagnosed, Doc.
Yeah, so usually when a patient comes to our office, and after taking the history, the medical history of the patient. First of all, most of the time, the patients, as I mentioned before, they can describe very well the condition themselves, because they have noticed the symptoms. For example, they go very often to toilet, and it's not as it used to be before, and they have this urgency and this frequency and this difficulty. So after doing that, the doctor has to do a couple of things. First of all, the urologists need to examine the prostate. This is a palpation of the prostate that gives us a lot of information about the size and the composition of the prostate. And then we usually ask for some tests, some blood tests. First of all, there is a specific test for the prostate called prostate-specific antigen, which is very important in order also to diagnose the possibility of a cancer and exclude this. And also we do some blood tests to check the renal function as well, because sometimes it is affected by this condition. And finally, we do an ultrasound. The ultrasound, which is a scan of the abdomen, can show us the size of the prostate, and we can see how the bladder is emptying and whether there is urine inside after the urination, which is a sign of obstruction.
Okay, so if BPH is left untreated, what happens?
A lot of things can happen. For example, with untreated BPH, they are more prone to infections. They do a lot of recurrent infections, and they keep coming to doctors because of this condition, since their bladder is not emptying properly. The second thing that is very, very common is they can see blood in their urine. Suddenly, without doing anything, all of a sudden they can see this blood coming out. And in very neglected cases, we might even see a problem with the renal function, with their kidneys, because when too much urine stays inside the bladder, sometimes it can make a reflux back to the kidneys. It is affecting the renal function, and it is really bad, because when the kidneys are affected from this condition, it's very difficult for them to recover. So that's why it's very important to make the diagnosis early on, in order to help the patient in the early stages and without causing any problems afterwards.
Okay, so I've been joined by Dr. George Haramis. He is with LuccaHealth Medical Specialty Center, and we are discussing basically common urological conditions and MIS treatment options. Is that it, Doc?
That's true.
Right. So let me find out, what are the treatment options you currently offer at LuccaHealth for patients with enlarged prostate? So
usually people who are diagnosed in the early stages, we can provide them medical treatment, and sometimes this is enough for a long time. And this kind of medications, they help the patient to pass the urine more easily without straining. And for those people, though, that they have tried the medical treatment for quite some time and they don't see much of improvement, then the next step is to do an operation there. And we're very lucky at LuccaHealth that we can provide a kind of treatment that it is without any bleeding. It is minimal invasive. Minimal invasive means it's a surgical procedure without opening the patient. So whatever we do through the natural openings, through the urethra. And what we can do is that we can evaporate, we can remove the part of the prostate that is blocking the passage of the urine. And there are a lot of men that I have seen in my office until now that are really afraid of this kind of operation because they've heard stories of long hospitalization and then bleeding and transfusion and some of that and all of that. But this is not the case anymore. I mean, this is a one-day procedure. It means that patients can come in the morning. We can do the procedure safely. They can stay there for a few hours, and the same day.
How long basically does treatment take?
It depends on the size of the prostate.
Okay.
Usually it's between 1 and 2 hours.
Okay.
And after that, the patients are staying in our facility for a few hours just for monitoring to make sure that they pass all our protocols. And if they're doing well, they can return back home for. With a catheter, of course, in place for a couple of days, and then after a couple of days they can come back. We remove the catheter, and the problem is solved.
All right. So for our viewers who are watching us live on Facebook and YouTube, if we need any other information, your location, contacts, if you're on social media, if you can put this out.
So our location is at East Legon. And is at Maseri Road, 27. It is very close to Lagos Avenue. We are in the same campus with MDS Lancet Laboratories and Quest Imaging. So we have a collaboration, all three of us, these two very well-known diagnostic centers, and with us who provide the clinical treatment. And we operate from Monday to Friday from 8 a.m. to 5 p.m. So whoever wants to see us can call our telephone center, which is, the number is 0544 120 777. So I can repeat, it's 0544 120 777.
Right.
So we can make an appointment. Of course, now because of the COVID, we always try to book appointments in advance, even though we see walk-in patients, of course, if they come to our facility. But we try to maintain a safety protocol for our patients. So we always try to take the temperature, history. We sanitize the hands, of course, and we try to make appointments in order to be safe for the patients and for us as well.
I guess you don't have any other branch. Do you have other branches?
We have a second campus as well.
Okay.
It's also in East Legon, not very far. It's close to the Acacia Medical Center. Our main facility is there in Lagos Avenue, as I said, close to Maseri Road. It's together with MDS Lancet. So this is our main campus. Are
you on social media? Facebook, Instagram? Okay.
Oh yes, we are, and it's very easy. If you Google us, you can definitely find us in Facebook and Instagram. And from time to time, we put all our newsletters and all the things that we do. And we're very excited and to welcome people there. And we're operating almost a year now, and I think the patients are really satisfied with the services we provide.
All right. Dr. Haramis, thank you very much for your time. I don't know if you have any final words for men like my type and yourself who may be having your final words.
I think the main message we have to pass to our listeners today and our viewers is that people and men has to not to be afraid. They have to come to see their doctor. It really saves the lives and of a lot of men. Just a simple visit every year. It's very easy to be done. As I said, it's just one time a year. You can spend a day just to visit your doctor that knows you very well, knows your history, and I think screening is everything, and this is something that we try, this culture of screening that we try to promote in our center, because this is something that is missing, and it's very, very important for our listeners to know that you can come and see us, and we can definitely provide solutions for you.
Right, Doc, many thanks for your time. Please do come again. Let's have another conversation.
It's been my pleasure. Thank you so much.
You're welcome.
Anytime.